CODAID currently is implementing a project that is in its ending phase called the Youth-Led COVID-19 Response Project. We have implemented this project in partnership with the SRHR Alliance in Uganda.
When COVID came in and there was lockdown, young people were significantly affected. Young people living with HIV could not access their treatment, so there was a threat of failing to meet their viral suppression. Young people who needed sexual reproductive health information like sexuality education.
So when COVID hit, especially for Uganda, it was around March when we noticed the first case. As CODAID here in Uganda, but also globally, we decided to respond to COVID-19. And again, the main idea was that we complement the work of the Ministry of Health here in Uganda and the World Health Organization. So we worked closely with the Ministry of Health here in Uganda, especially to identify what was being done to respond and the existing gaps then.
Young people needed sexual reproductive health services such as contraceptives, condoms. They could not access them. Some of them got, pregnant, got risk of sexually transmitted diseases, and they didn't know where to get help. So when we contacted our partner CODAID, we thought it was important that we do something about these challenges, and particularly the young people in West Nile, where we have also the refugee communities, were at greater risk. And at that time, the risk of infection were very high in West Nile because of the truck drivers and a number of cross-border points. So we needed to respond immediately.
We identified the SRHR Alliance partner who was already our partner on our SRHR work, but we realized we could contribute to the response of COVID-19. We interested ourselves a lot in a youth-led approach, again with a realization that really responses by then to COVID-19 were not so much integrating young people. And again, we had young people at this particular time also facing several challenges as a result of COVID-19. Schools had been closed. We had many young people back home and in the communities without so much to do. So involvement of young people at the forefront of responding to COVID-19 for us was really powerful.
So we designed this intervention, which was a very innovative intervention, linking information to services, but being driven by young people. And so we had young people reaching out to their fellow young people in the rural areas, providing them with the treatment, like for those young people living with HIV, providing them information. So it was young people for young people, actually.
The project actually yielded quite a lot at a time when the country was battling with the pandemic, and especially the effects of the pandemic. You remember we all had the lockdown, which was so biting in a way that almost everything came to a standstill, transport, even health services. But this brought in and said, no, sexual reproductive health services, especially family planning, cannot just be under lockdown.
When the project came in, we were happy that we received it, and also it helped us a lot in the following ways. UNIPA came to us and brought for us means of transport at the bicycle at a difficult situation by then, whereby most of the adolescents who were on drugs could not really get their drugs on time, and others were delaying. But the means of transport helped us to reach to them.
This fund also helped us again in carrying out adolescent health outreaches in many sub-counties and many communities.
It had been good. We're partnering as Reach a Hand with Reproductive Health Uganda, and then UNIPA under the umbrella of CODAID and SRHR Alliance.
So UNIPA came up, they brought for us sanitizers that we could use, face masks, and then also t-shirt for identification. Yeah, we had them, whereby we can reach the community. If sometimes we go to the LC, they will say, yeah, maybe this is an organization who is trying to help people around.
And the sanitizers, the liquid soap which was supplied, and our cleanliness improved in the facility. The place was ever kept very clean because the detergents were available.
6-month period, we managed to see about 4,136 clients during that period, with about 19,553 SRH services, and majority of them were actually family planning.
The project was fun, it was interesting. We met the targets, though it was hard based on the fact that the project was related to COVID, and then the COVID period, it was a tough one.
Like it's raining, we could not reach on time. Sometimes bicycles get spoiled. We first have to work on them.
During the COVID-19, we had a problem with the accessing service by the adolescents, but then because this service was there, we were able to go with the service to the community.
Something that was for 6 months was not enough, and therefore there was actually a need for more. There was a high demand for the services.
My emphasis is on our adolescents and the peer mentors. If some of these peer mentors could be given some employment so that they can work in such facilities to coordinate, to do what, so that at the end they have something to sustain them.
So the project was a very huge success, and we are just kind of looking forward for something more of that to happen.
We should continue to remain vigilant about the issue of the COVID, especially personal protection.
So they should continue supporting the sexual reproductive health rights and alliance.
And our other emphasis is that this project still need to be scaled up, and so we are calling upon all other partners who are interested to come and work with the Alliance to scale it up. But generally we would like to thank our partner CODAID for the resources that they have provided for us to pilot this project, and we hope that we can be able to do more in the coming future.
We intervened with this project when we had just registered a case in Uganda. Today we are speaking thousands of cases and hundreds of deaths. So indeed the need is still very present, and together as partners it's important that we look into how we can sustain results of the YCR project, but also scaling this up to even other geographical locations.